Nowadays, world is increasingly threatened with natural and man-made disasters. Following a disaster, health teams concern more on management of acute illnesses and prevention of communicable diseases. This will give rise to an increase in NCD emergencies, increase in complications, and ultimately premature deaths. So it is very important to manage NCDs during such a situation. This module will help you to learn about NCD care during an emergency situation.
NCD care in emergency preparedness and response. At the end of this module, the learner should be able to describe the need to focus on NCDs in emergency preparedness and response, describe interventions to prevent excess morbidity and mortality related to NCDs during emergencies and disasters, appreciate Sri Lankan response to maintain NCD services during COVID-19 pandemic. Recent years have demonstrated the devastating health consequences of natural hazards such as the devastating hurricanes, floods, and man-made disasters such as conflicts. The WHO Southeast Asia region, to which Sri Lanka belongs to, has experienced numerous health emergencies such as earthquakes and floods. The current COVID-19 pandemic is much more than a disaster. It is a global crisis. It is likely that the world will see an increase in disasters and their resulting health impacts in the coming years. Traditionally, health emergency response has largely been focused on prevention of communicable diseases. In the light of high and ever increasing burden of NCDs in countries, there is an increasing realization that these factors can also interact to impact the lives of people living with NCDs. Lack of appropriate care during emergencies results in long term morbidity and disability associated with NCDs. Emergencies are typically characterized by damage to infrastructure. This would include general infrastructure such as building, roads, electricity, communication, water supply, etc., and health infrastructure such as health facilities. Occurrence of physical injuries, including direct traumatic injuries to individuals, often leading to long term disabilities. Forced displacement of people resulting in loss of access to existing medication and or assistive devices, loss of prescription, lack of access to healthcare services due to displacement leading to prolonged disruption of treatment. Degradation of living conditions like loss of shelter, inadequate or unsafe shelter in new settlements or camps, shortage of water and regular food supplies, and lack of income, adding to physical and psychological strain. Loss or separation from family members resulting in inadequate family support. There are several ways in which excess morbidity and mortality related to NCDs during emergencies and disasters might occur. These include interruption of care through the destruction of health infrastructure, disruption of medical supplies, and inability to access health care providers who have been killed, injured, displaced, or unable to return to work. This can also include interruption of electricity or safe water supplies, which may have life threatening consequences for people with end stage renal failure requiring dialysis. During the emergency phase, a sudden shift in priorities of the healthcare system and providers for infections disease prevention will occur, requiring management of NCDs rather than the continuity of treatment of patients who are already on treatment for NCDs. As the established system has been broken, health facilities are unable to function safely and provide quality care for all patients. Changes in living conditions result in changes in diet and physical activity habits, often throwing off the delicate balance in most of the NCD patients, including diabetics and hypertensive patients. Increase in risk in patients with pre existing diseases such as CKD, chronic liver diseases, or chronic heart diseases. People in these settings are almost always stressed, which often elicit physiological responses that are detrimental to the control of NCDs. Adherence to medication invariably decreases due to disruption in supply chain and consequent change in living habits. Other injuries or infections may precipitate a crisis, especially in heart diseases or diabetes. A comprehensive approach to NCD management in emergencies is an important but neglected aspect of humanitarian response. One of the most pertinent measures is to incorporate management of NCDs into existing emergency related national policies, standards, and resources. Most of the NCD patients could die prematurely due to acute complications. A clear and coordinated action plan tackling the challenges posed by NCDs before, during, and after disasters is a must. A multi sector participation and collaboration is mandatory. In Sri Lanka, preparedness of the health sector to disasters and emergencies is coordinated by the Disaster Preparedness and Response Division of the Ministry of Health. The strategic plan for 2015 is based on 6 strategic directions as shown. As the country is successfully combating against COVID-19 infections, the health system in Sri Lanka faces many challenges in maintaining and providing the usual medical services. Being a country with high burden of non-communicable diseases, several steps were taken to prevent a second wave of deaths due to NCDs. Maintenance of NCD related services was identified as a priority in the National COVID 19 Response Plan. Following actions and initiatives were taken to maintain NCD preventive and curative services during this critical period. Ensuring continuous supply of medicines for patients with a NCD. For patients who are taking medicines and followed up at NCD clinics at government hospitals, medicines were delivered to their doorsteps using the Department Postal Services. Patients who are taking medicines and followed up at NCD clinics at government hospitals, medicines were delivered to their doorsteps using the Department of Postal Services. For patients who could afford to purchase medicines from state or private pharmacies, a web based mechanism was introduced to deliver medicines to the doorstep through state and private pharmacies in collaboration with the Pharmacy Owners Association. Provision of inward care and emergency services for NCD patients. Each and every hospital provided emergency care services for patients with NCDs depending on their service capacity. The Emergency Ambulance Service 1995, each and every hospital provided emergency care services for patients with NCDs depending on their service capacity. The Emergency Ambulance Service was functioning island-wide to transport patients to the nearest hospital in case of an emergency. Provision of medical care for NCDs through telemedicine and digital solutions. Introduce telemedicine for consultations to prevent overcrowding at the clinics at tertiary level hospitals and to minimize exposure of high risk immune compromised NCD patients such as those undergone kidney transplant or on dialysis to COVID 19. Continuing patient information services. Several helplines were established at the Ministry of Health to provide information on NCD related issues. Provision of guidance for healthcare staff on NCD management during COVID 19. Guidelines were issued for healthcare staff on management of patients with NCDs in hospitals during COVID 19 outbreak. Promotion of health lifestyles during this pandemic situation. Mass media and social media campaign targeted both people living with NCDs and the normal population. Emergencies and disasters have many adverse impacts on lives of people living with NCDs. A comprehensive approach to NCD management in emergencies is an important but neglected aspect of humanitarian response. One of the most pertinent measures is to incorporate management of NCDs into existing emergency related national policies and standards.